The more wildfire smoke and air pollution that we're exposed to, then the greater the impact it will have on our bodies.
Raging wildfires are pushing smoke into the lower mainland, with wind picking up the haze from fires scorching through the BC interior. And while the region has largely avoided smoke, experts warn about the severe damage poor air quality can do to those already suffering from health conditions.
So we see evidence of heart attacks, more strokes, more complications of diabetes, extreme difficulty breathing, so that will lead to hospitalization and eventually death. But for the general public, we don't really know, kind of because we haven't had this sort of, really extended kind of exposure.
Dr. Michael Bauer from UBC notes there's evidence firefighters' lung function drops at the end of the season, and it's worse the next year. He says for those without health conditions, long-term impacts become a concern when poor air quality lasts more than a month.
With winds coming in out of the north-northeast, that has the potential to draw in at least some light wildfire smoke back toward the south coast. Nothing as extensive as what we saw on the weekend, but maybe a little hazy under a sunny sky into Wednesday and Thursday.
Fire Smoke Canada's research team from UBC shows the smoke drifting into the lower mainland in the next day. The smoke isn't expected to create some of the conditions that we saw recently when at one point Vancouver had the worst air quality of all major cities in the world.
A lot of what we're seeing in the lower mainland is also above ground level, so that's contributing to a very noticeable haze and a reduction of visibility, even though not all of the fine particulate is contained near the ground where we're breathing it.
Someone with asthma, COPD, or long COVID could set up a plan to make sure that they have their rescue inhalers at home with an extra supply. In case they need to evacuate, they can make a plan about where they can get extra inhalers.
There's still a lot to learn about prolonged health impacts as more research is done on COVID long haulers and generally healthy people experiencing more summers surrounded by thick smoke.
What we know from air pollution in general is that when we start to get into a month or 2 months of these very, very high levels of exposure, that this does lead to long-term impacts, basically a life shortening.
In Vancouver, Crystal Laderas, City News.